Hi folks, so a few years ago I had a crash on a velodrome. I was racing, trying to qualify for the Olympics in track cycling. I had a crash. I was taken unconscious to a hospital and landed in a $250,000 health debt. This stuff happens all the time in America. I think my story was interesting. It was picked up by NPR, CBS. I was in a Bernie Sanders commercial. Last time I talked about it, it was unresolved. People ask me for advice on this all the time, and I have sent a bunch of advice via email. Folks also just ask for updates. I get that pretty often. Of course, there was an incident where the CEO of United Healthcare was murdered. My insurance was with United Healthcare. So that led a lot of folks, all of a sudden, I got a bunch more messages asking, hey, whatever happened with your thing, Phil? I was sort of scared to say it out loud, but I do believe I've beat that debt. I think the whole mess is over. And I thought now that the topic is kind of in the media, this would be a good chance to explain what happened, how I got out of it, maybe how it applies to you. This is the velodrome in Chestertown, Pennsylvania, when the crash happened. I don't exactly remember the crash. That's probably for the better. I was taken to the nearest emergency room by ambulance. They found a broken collarbone, scapula, and just about all of my ribs, which led to a collapsed lung. The broken bones hurt. The collapsed lung is life-threatening. I believed that I was going to be fully covered for this situation. I had health insurance from United Healthcare. I had a secondary insurance through USA Cycling, that provides like event insurance. I was fundraising for No Get Hungry at the time. I was on a lot of morphine. So in my hospital bed, I looked at the camera and I said, hey, how much would you donate to a GoFundMe to help my medical expenses? Well, good news, I'm covered. I don't need any help. So please kick that money in to No Get Hungry instead. That was kind of the best thing I've done in my life, I think. That raised $250,000. 2.5 million meals for kids. The irony there is that that $250,000 was about the debt that I would land in a few months later. So the first hospital, they took care of the collarbone pretty quick, they took care of the lung, but the scapula was a really bad break. That's a tricky surgery. So every day they would say, hey, we've got a surgeon coming in tomorrow to fix that, you're gonna fast. Then the surgeon would walk in the morning and look at it and be like, ooh, I don't know if I can handle that break. You better find somebody else. That happened 3 days in a row. So I was stuck in crazy amounts of pain, just one of those rolling around in pain, waiting for the next morphine button, as this hospital failed to find a surgeon who could fix it. At one point, they told me I should fly to UCLA. I didn't like the idea of a Southwest flight in that amount of pain. I started desperately messaging every athlete I know, my sports agent. Finally, just through a friend, I was connected to a hospital in Manhattan. Just got the phone number to a total badass surgeon. So he got me in. My mom had flown up with my stepdad. They drove me over from Pennsylvania to Manhattan. Just an aside then, I was sponsored at that point by Nove Bikes, this new bike brand that no longer exists. They chose that night, things weren't going great with them as it was, but they chose that night from between one hospital to another to tell me that I was fired in June for a one-year contract. Just garbage people. Those are the owners of the Pell Mafia cycling brand. So don't buy that stuff. The hospital in New York was out of network. I knew that going in, but I'd also done enough homework to know that I was just going to have to show that the surgery was necessary and there was nowhere else that it could get done. Given that they couldn't find anyone on the East Coast to do it, I figured it was going to be some paperwork, it was going to be some arguments, but I would get that covered eventually. The surgery went great. I woke up the next morning and in my morphine state, I'd ordered myself a dozen cookies from Levain Bakery. That was great, gave some to the nurses. Left there, the recovery was terrible. It was months of physical therapy, tons of pain. Honestly, one of the toughest periods of my life. And then the bills started coming. First, it was $100,000 from the New York hospital. First, I tried to get the insurance company to take care of it. For months, I'm writing letters, making phone calls to the hospitals and to United Healthcare, explaining here's why the surgery was necessary, here's the 5 doctors who could tell, oh yes, that definitely needs surgery. So per their policies, this should be covered by insurance. I just thought it was a big misunderstanding. The insurance company calls the hospital, and that hospital in New York just straight up lied to them. They said, A, it was a voluntary procedure. It was definitely not voluntary. And B, they said it was outpatient, but I definitely spent the night there. And they lied because they don't want to negotiate with insurance companies. Insurance companies infamously pay less. They wanted me to pay retail. So my insurance hears that and says, well, that's exactly what we wanted to hear. Wiping our hands of this. Not our problem. Case closed. This is Phil's issue, you can bill him direct. What happens next, which is called balance billing and is now illegal, is the hospitals can bill the patient for the difference of the fee. And they can sue me if they want to. At this point, there's a lot of letters. I'm printing out all these documents like an itemized receipt from the hospital down to like how many gauze strips they used and tongue depressors. Then the next bill came for $150,000 from the first hospital, which apparently was also out of network. So my total debt was $250,000. That's 100 from one hospital, 150 from another one, $100,000. Over time, I feel like I could pay that. I can handle it. It's going to set me back a few years, but that's not going to ruin my life. When it goes up to 250, Well, now it's war. Now, the New York hospital, I knew it was out of network. I signed a thing saying I understand that. This one, I was taken to unconscious. Now, emergency procedures should be covered by insurance, whether they're in network or out of network. But this hospital had put me in the burn ward. They said it was because there wasn't room in the ER. I wonder if that's what they couldn't classify me as an emergency. And again, they could charge me retail instead of dealing with insurance. My insurance did pay for the collarbone surgery was necessary, but they didn't want to pay for the 3 days where I was sitting there waiting for the hospital to ultimately fail to find the surgeon for my scapula. I don't even blame them for that. I wouldn't pay for that either. I mentioned I'd have secondary insurance through USA Cycling for the event. Of course, they just get that through another insurance company. I spoke to that company. Turns out that budget was capped at $25,000. And I was like, okay, let me negotiate with that. Let me use that and go to these departments and say, hey, look, I don't have 250, but let me give you 10% and then you'll leave me alone. This is out of my expertise, but I don't negotiate. And I know like money in hand might get something done. And a lot of times like that is what insurance pays. Insurance probably pays about 10% of the sticker price on deals like this. I thought I could wipe out a good percentage of this debt, if not all of it, with that $25,000. I still can't figure out, for some reason, they just wrote one check to one department arbitrarily and knocked the bill down from $250 to $225. The secondary insurance didn't help me at all. It did pay one of the surgeons, so that part's great. I hold nothing against surgeons, nurses, doctors. Like, they're heroes. They're doing the real work. I want them to be compensated. I don't want to rip those folks off. It's the middleman that's the problem. It's the middleman that costs so much money to the U.S. taxpayers and citizens. After 6 months or so, both the hospitals sent the bills to collections. At this point, I was pretty freaked out. I started talking about it online, asking for advice. People kept asking if I would do a GoFundMe, and I was like, I shouldn't have to pay this. I'm not going to ask my friends and network and followers to help pay this. Nobody should have to pay this. Depending on which hospital they were collecting from, I wrote a letter for each one explaining how they failed to find a surgeon, why this charge was invalid, why I shouldn't have been in the ICU. The other hospital, this is an inpatient procedure. This was not a voluntary procedure. They lied to my insurance. This all should have been covered. The exact wording that I learned is appropriate to use is, I reject the validity of this bill. I sent that letter to so many collections agencies. A lot of them would respond back and say, hey, we agree with you. We're no longer going to collect this debt. We're moving on. And then it would just go to a different collections agency with the same letter. I go back and forth. I spent $100 probably just on stamps. So aside from I'm trying to recover from a terrible accident and a bunch of broken bones, they're adding this crazy amount of stress, fear, and just paperwork. And in the back of my mind the whole time, I'm like, are they going to sue me? Am I going to lose my house? The United States collectively spends more money on healthcare than anyone else in the world and has a lower life expectancy than many comparable countries. Our medical care here is great. Some of the best teaching hospitals, research, all that stuff is done here. But the bang for the buck is actually quite awful compared to the rest of the developed world.